Doctor explains what it means if you wake up with a dry mouth. Picture this moment. Your alarm goes off. You open your eyes, and before you even have a chance to think about the day ahead, you notice something uncomfortable. Your tongue feels thick and sticky. Your lips are cracked. Your throat feels raw, almost like you spent the entire night breathing in dust. You reach for the glass of water on your nightstand and gulp it down like you have not had a drink in 3 days. And for a brief moment, you feel relief. Then you get up, brush your teeth, start your morning routine, and completely forget about it. Until the next morning, when it happens again. And the morning after that, and the morning after that. At some point, you stop questioning it. You convince yourself this is just how mornings work. You assume everyone wakes up this way. You tell yourself it is probably because you did not drink enough water before bed, or because you slept with your mouth open, or because the air in your room is too dry. And so you never think about it again. But here is what I need you to understand before we go any further. Waking up with a dry mouth on a regular basis is not normal. It is not something your body does without reason, and it is absolutely not something you should be ignoring. Your body does not generate random sensations. It does not send you signals for entertainment. Every symptom you experience, every discomfort, every unusual feeling has a cause. And when your body wakes you up with a mouth that feels like sandpaper morning after morning, it is trying to communicate something important. The problem is that most people never stop to listen. They dismiss it. They normalize it. They assume that because everyone seems to deal with it, it must not matter. But I have seen what happens when this signal gets ignored for years. I have seen the conditions that develop silently in the background while people brush off this one seemingly harmless symptom. And I can tell you with complete confidence that a dry mouth in the morning can be one of the earliest warning signs of problems that extend far beyond your oral cavity. I'm not saying this to alarm you unnecessarily. I am saying this because understanding what your dry mouth actually means could genuinely change your health trajectory. It could help you catch something early that would otherwise go undetected. It could give you the information you need to make changes that prevent serious complications down the road. Today, I'm going to walk you through exactly what your body might be telling you when you wake up with a dry mouth. I'm going to explain the most common causes, the most serious causes, and the causes that almost nobody talks about. I'm going to break down the science in simple terms so you actually understand what is happening inside your body. And I am going to give you a comprehensive action plan so you know exactly what to do about it. But I need you to stay with me through this entire video, because this is not a topic where you can skip to the end and still understand what matters. Each piece of information builds on the last, and the solutions I share toward the end will only make sense once you understand the full picture. So if you've been waking up with a dry mouth and wondering whether you should be concerned, you are in the right place. And if you care about understanding what your body is trying to tell you, take a moment right now to subscribe to Wellness Secrets and tap that notification bell. We break down health topics like this regularly, and the information we share could make a real difference in how you take care of yourself. Now, let us start with something most people have never considered. Before we can understand why your mouth is dry in the morning, we need to understand what is supposed to be happening in the first place. Your mouth is designed to stay moist, not just during the day when you are eating and drinking, but constantly. Even when you are asleep, even when you have not had anything to drink for hours, your salivary glands are supposed to be working around the clock to maintain a baseline level of moisture in your oral cavity. Now, it is true that saliva production naturally decreases during sleep. This is normal. Your body downregulates certain functions while you rest, and saliva production is one of them. But here is the critical distinction most people miss. Your salivary glands should slow down during sleep. They should not shut off completely. Even at reduced capacity, your mouth should still have enough moisture to stay reasonably comfortable throughout the night. If you are waking up with a mouth so dry that it causes genuine discomfort, something has disrupted this process beyond the normal sleep-related reduction. And this matters far more than most people realize, because saliva is not just water sitting in your mouth. It is one of the most functionally important fluids in your entire body. Let me explain what saliva actually does. First, saliva contains digestive enzymes that begin breaking down food before it even reaches your stomach. This is why chewing your food thoroughly matters so much. The digestive process starts in your mouth, and saliva is essential to that process. Second, Saliva contains antibacterial compounds that actively fight harmful microorganisms. Your mouth is a warm, moist environment that bacteria love. Without saliva constantly working to control bacterial populations, harmful organisms would multiply unchecked. Third, saliva helps maintain a stable pH balance in your mouth. This is critically important because an acidic oral environment accelerates tooth decay and creates conditions where harmful bacteria thrive. Saliva acts as a natural buffer, neutralizing acids and keeping things balanced. Fourth, saliva lubricates and protects your oral tissues. Your cheeks, tongue, gums, and the delicate lining of your mouth all depend on saliva to stay healthy and intact. Without adequate lubrication, these tissues become vulnerable to damage, irritation, and infection. Fifth, saliva contains minerals like calcium and phosphate that actively repair early-stage damage to your tooth enamel. This process is called remineralization, and it happens constantly when your mouth is functioning properly. When your saliva production drops significantly, every one of these protective functions becomes compromised. Your mouth becomes a fundamentally different environment. The bacteria that cause cavities and gum disease gain an advantage. The acids from food and beverages do more damage. The delicate tissues of your mouth begin to suffer. So the dry mouth you feel in the morning is not just about discomfort. It is evidence that your oral environment has been compromised for hours while you were sleeping. And if this happens night after night, week after week, month after month, the cumulative effects begin to add up. But here is the most important thing I want you to understand about dry mouth. The dryness itself is not the core problem. The dryness is a symptom. It is a messenger. It is your body's way of telling you that something deeper is going on, and it wants you to pay attention. The real question is not how to make your mouth feel less dry in the morning. The real question is, what is causing the dryness in the first place? And that is exactly what we are going to explore now. The first cause I always consider when someone tells me they wake up with a dry mouth is their breathing pattern during sleep. This is by far the most common explanation, and it comes down to basic physics. If you're breathing through your mouth while you sleep, air is constantly flowing across your oral tissues for hours at a time. That airflow evaporates moisture from your tongue, your cheeks, your gums, and your throat. By the time you wake up, your mouth feels like a desert because it has literally been dried out by the continuous passage of air. Now, under normal circumstances, you should be breathing through your nose while you sleep. Your nasal passages are specifically designed to handle your breathing needs. They filter incoming air, removing particles and pathogens. They warm the air to body temperature before it reaches your lungs. And they humidify the air, adding moisture so that it does not dry out your respiratory tissues. When you breathe through your mouth instead, you bypass all of these functions. You take in air that is unfiltered, poorly temperature regulated, and much drier than what your body is designed to receive. The question then becomes, why would someone breathe through their mouth during sleep in the first place? The most straightforward explanation is nasal obstruction. If your nasal passages are partially or fully blocked, your body has no choice but to switch to mouth breathing. There are many potential causes of nasal obstruction. Seasonal allergies can cause swelling and congestion that blocks airflow. Chronic sinus inflammation can create persistent obstruction. A deviated septum, which is a structural irregularity in the wall dividing your nasal passages, can restrict airflow on one or both sides. Nasal polyps, which are non-cancerous growths in the nasal passages, can also create obstruction. For some people, addressing the underlying cause of nasal obstruction is enough to resolve their dry mouth completely. Once they can breathe comfortably through their nose again, they stop mouth breathing, and the dryness goes away. But here is where things get more serious. For many people, mouth breathing during sleep is not caused by nasal obstruction at all. It is caused by something happening in the throat. And this is where we need to talk about obstructive sleep apnea. Obstructive sleep apnea is a condition where the tissues in the back of your throat relax excessively during sleep and partially or completely block your airway. When this happens, airflow is restricted or stops entirely, and your body has to work harder to breathe. What happens next is a cascade of events that most people are completely unaware of. When your airway becomes obstructed, the oxygen levels in your blood begin to drop. Your brain detects this drop and triggers a stress response to wake you up just enough to resume normal breathing. Your heart rate increases. Your blood pressure spikes. You might gasp, snort, or choke as your body fights to get air in. And then, once the airway is open again, you drift back towards sleep, only for the cycle to repeat. This can happen dozens of times per hour throughout the night. And the terrifying part is that most people have no memory of these events in the morning. They sleep through the micro-awakenings. They never hear themselves gasping. They have no idea that their oxygen levels have been plummeting repeatedly for hours. All they know is that they wake up with a dry mouth, a headache, and a crushing sense of exhaustion that does not match the number of hours they were in bed. The dry mouth in this case happens because the body's desperate attempts to get more air cause the mouth to open wide. The gasping and heavy breathing pull large volumes of air across the oral tissues. And the stress response that activates with each obstruction event further reduces saliva production. But the dry mouth is honestly the least of the concerns when it comes to sleep apnea. Untreated obstructive sleep apnea puts enormous strain on your cardiovascular system. Every time your airway closes and your oxygen drops, your heart has to work harder. Your blood pressure elevates. Your body releases stress hormones like cortisol and adrenaline. And because this happens over and over throughout the night, every single night, the cumulative damage begins to add up. Research has clearly established that untreated sleep apnea significantly increases the risk of high blood pressure, heart attack, stroke, irregular heartbeat, and heart failure. There is even evidence linking sleep apnea to sudden cardiac death. And it does not stop there. The fragmented sleep caused by apnea events prevents you from getting adequate deep sleep, which is when your body does most of its repair and restoration work. Over time, this contributes to cognitive decline, memory problems, mood disturbances, weight gain, and impaired immune function. People with untreated sleep apnea often report feeling like they have not truly slept in years. They drag themselves through the day, relying on caffeine. They struggle to concentrate. They fall asleep at inappropriate times. They experience irritability and depression. And they assume this is just how life feels as they get older. But it does not have to be this way. Here is what I want you to consider carefully. If you wake up with a dry mouth regularly, and you also experience any of the following, sleep apnea should be on your radar. Loud snoring, especially if it is accompanied by periods of silence followed by gasps or choking sounds. Waking up with headaches, particularly in the front of your head. Excessive daytime sleepiness despite spending adequate time in bed. Difficulty concentrating or remembering things. Falling asleep unintentionally during passive activities like watching television or riding in a car. Waking up frequently during the night, even if you do not know why. Waking up to urinate multiple times per night. Mood changes, including increased irritability or symptoms of depression. And if your partner has ever told you that you stop breathing during sleep, or that your snoring scares them, or that you make strange choking sounds, please take that seriously. They are witnessing something you cannot see, and their observations could be crucial. Sleep apnea is dramatically underdiagnosed. Studies suggest that the majority of people with this condition have no idea they have it. They have normalized their symptoms. They have attributed their fatigue to stress, age, or a busy lifestyle. They have never connected their dry mouth to anything more serious, and all the while, their cardiovascular system is being damaged night after night. The good news is that sleep apnea is highly treatable. A proper sleep study can determine whether you have the condition and how severe it is. And treatments like continuous positive airway pressure therapy, commonly known as CPAP, or oral appliances that reposition the jaw, can be remarkably effective. People who get properly treated for sleep apnea often describe the experience as life-changing. Their energy returns, their mood improves, their blood pressure comes down, their cognitive function sharpens, and yes, their dry mouth resolves. That morning dryness they had accepted as normal for years was actually the most obvious clue that something serious was happening while they slept. And once the underlying problem was addressed, the symptom disappeared. If any of this sounds familiar to you, please do not ignore it. Talk to your doctor about getting a sleep evaluation. In many cases, you can even do a home sleep study that is convenient and relatively simple. Your dry mouth might just be the warning sign that saves your life. But sleep apnea is not the only serious cause of morning dry mouth. And the next cause I want to discuss is one that catches most people completely off guard. It affects millions of people, who have no idea their blood sugar is silently climbing into dangerous territory. And the dry mouth they experience every morning might be the earliest sign that something metabolic has gone wrong. When your blood sugar levels are elevated beyond where they should be, your body initiates a process to try to correct the imbalance. And this process has direct consequences for how hydrated you feel when you wake up. Here is how it works. Under normal circumstances, the glucose in your blood gets transported into your cells where it is used for energy. Insulin, a hormone produced by your pancreas, acts like a key that unlocks your cells and allows glucose to enter. When this system is working properly, your blood sugar stays within a healthy range and everything functions smoothly. But when your body either does not produce enough insulin, or when your cells become resistant to insulin's effects, glucose starts to accumulate in your bloodstream. Your blood sugar rises higher than it should, and your body recognizes this as a problem that needs to be addressed. The solution your body comes up with is to flush the excess glucose out through your kidneys. Your kidneys begin filtering more glucose out of your blood and excreting it through urine. But glucose is what scientists call osmotically active, which means it pulls water along with it. So when your kidneys excrete excess glucose, they also excrete a significant amount of water. This is why frequent urination is one of the classic signs of elevated blood sugar. Your body is literally trying to wash the excess glucose out of your system. But in doing so, it is also depleting your fluid reserves. The result is a state of progressive dehydration that many people do not even recognize. You are losing more water than usual through urination, often without increasing your fluid intake to compensate. And one of the earliest and most noticeable signs of this dehydration is waking up with a dry mouth. What makes this particularly concerning is that blood sugar problems develop gradually. They do not appear overnight. The progression from normal blood sugar to prediabetes to full diabetes typically happens over years or even decades. And during this slow progression, most people have no obvious symptoms. They feel relatively normal. They have no idea that their metabolic health is quietly deteriorating. But the dry mouth might be there. It might be showing up every morning, trying to get your attention while you dismiss it as nothing important. Think about whether any of these experiences sound familiar to you. You find yourself getting up to use the bathroom multiple times during the night, more than you used to. You feel thirsty frequently throughout the day. Even when you've been drinking water, you notice that minor cuts, scrapes, or wounds seem to take longer to heal than they did in the past. Your vision occasionally seems blurry for no apparent reason, then clears up again. You feel more fatigued than you think you should, even when you are getting adequate sleep. You experience tingling sensations or numbness in your hands or feet. You have noticed unexplained weight changes, either loss or gain. Any one of these symptoms in isolation might not mean anything significant, but when several of them appear together, and when they are accompanied by persistent morning dry mouth, they form a pattern that should not be ignored. The window of opportunity here is critically important to understand. When blood sugar problems are caught early, in the pre-diabetic stage or in early diabetes, there is often a tremendous amount that can be done to reverse or significantly slow the progression. Dietary changes, increased physical activity, weight management, stress reduction, and improved sleep can all have a profound impact on metabolic health. In some cases, people are able to bring their blood sugar completely back into the normal range through lifestyle modifications alone. But when blood sugar problems go undetected for years, the consequences become more severe and more difficult to reverse. Chronically elevated blood sugar damages blood vessels throughout your body. It damages nerves. It damages your kidneys. It damages your eyes. It increases your risk of heart disease and stroke. It impairs wound, healing, and immune function. It can lead to complications that significantly reduce quality of life and lifespan. The difference between catching this early and catching it late can be enormous. And that simple morning dry mouth might be your body's way of giving you an early warning. If you have not had your blood sugar checked recently, please consider doing so. A simple fasting glucose test, or hemoglobin. A 1C test can give you valuable information about where your metabolic health stands. These tests are inexpensive, widely available, and could provide you with information that changes everything. This is especially important if you are over the age of 40, if you carry excess weight, particularly around your midsection, if you have a family history of diabetes, or if you have any of the symptoms I just described. Do not wait for the symptoms to become obvious. By the time diabetes becomes obvious, significant damage may have already occurred. The dry mouth is your early signal. Pay attention to it. Now, the next cause of morning dry mouth is one that affects an enormous number of people. And yet it rarely gets the attention it deserves in these conversations. The medications you take might be directly responsible for your dry mouth. This is something that catches many people by surprise. They have been taking a medication for months or years. They have noticed that their mouth seems drier than it used to be. But they never connected the two because no one ever told them that dry mouth could be a side effect. The reality is that hundreds of commonly prescribed medications can reduce saliva production. And when I say hundreds, I am not exaggerating. The list is extensive and includes medications that millions of people take every single day. Let me walk you through some of the most common categories. Antihistamines are among the most frequent culprits. These are the medications people take for allergies, for cold symptoms, and for sleep. They work by blocking histamine receptors, but in doing so, they also affect the receptors in your salivary glands that stimulate saliva production. If you take antihistamines regularly, especially the older first-generation types, dry mouth is an extremely common side effect. Antidepressants, particularly those in the selective serotonin reuptake inhibitor category and the tricyclic category, are well known for causing dry mouth. These medications affect neurotransmitter systems in your brain, but those same neurotransmitters also play a role in salivary gland function. Many people who start taking antidepressants notice a significant change in how their mouth feels, especially in the morning. Blood pressure medications frequently cause dry mouth as well. Diuretics, which work by increasing urine output to reduce fluid volume in your body, can leave you dehydrated and dry. Other blood pressure medications, like ACE inhibitors, beta blockers, and calcium channel blockers, can also affect saliva production through various mechanisms. Pain medications, including both over-the-counter and prescription options, are another common cause. Opioid medications are particularly notorious for reducing saliva production. But even non-opioid pain relievers can contribute to dry mouth in some people. Medications for anxiety, muscle relaxants, medications for urinary incontinence, medications for Parkinson's disease, medications for nausea, and many others all have dry mouth listed among their potential side effects. And here is what makes this particularly challenging. Many people take multiple medications. The average adult over the age of 65 takes 4 or more prescription medications. Each of those medications might have some effect on saliva production, and when you combine them, the effects can compound. Someone who takes a blood pressure medication, an antihistamine for allergies, and a medication for sleep might be experiencing dry mouth from 3 different sources simultaneously. And they might have no idea that their medications are the cause, because each individual medication's effect seems minor. I want to be very clear about something here. I am absolutely not telling you to stop taking your medications. That would be irresponsible and potentially dangerous. Many of these medications are essential for managing serious health conditions. Stopping them without medical supervision could have severe consequences. What I am telling you is that you need to be an informed and active participant in your own healthcare. If you are experiencing dry mouth, make a complete list of every medication you take. Include prescription medications, over-the-counter medications, and supplements. Bring this list to your doctor or pharmacist and have a specific conversation about dry mouth as a side effect. Ask whether any of your medications are known to cause dry mouth. Ask whether there are alternative medications that might be less likely to cause this side effect. Ask whether adjusting the timing of your medications might help. Ask whether there are strategies to manage the dry mouth while continuing your necessary treatments. Sometimes the solution is surprisingly simple. Switching from one blood pressure medication to another in the same class might eliminate the dry mouth entirely without compromising the effectiveness of your treatment. Taking a medication at a different time of day might reduce its impact on your sleep and your morning symptoms. Adding a medication specifically designed to stimulate saliva production might be appropriate in some cases. The point is that you have options, but you will never discover those options if you do not have the conversation. If this information about medications resonates with you, I would appreciate it if you took a moment to hit the like button on this video. It helps more people find this content, and it tells me that this kind of detailed health information is valuable to you. And if you have not subscribed to Wellness Secrets yet, now is a great time to do that. We consistently create content designed to help you understand your body and make better decisions about your health. Now, we have covered two major causes of dry mouth so far, but there are several more that you need to know about. And the next one is something that almost everyone thinks they understand, but almost everyone gets wrong.